Welcome to our deep dive into rheumatoid arthritis. Wow, you really weren't kidding about wanting the full picture. Medical texts, research papers, personal stories. This is going to be quite the journey.
It is. And what's surprising to many is that RA isn't just those aches and pains you get as you get older.
Like, I always thought osteoarthritis, wear and tear on the joints.
It's easy to think that, but with RA, it's way more complex.
So not just my knees creaking when I go up the stairs.
Could be, but RA is an autoimmune disease. Basically, your immune system is attacking your own joints. That causes inflammation and then, over time, real damage.
Hold on, so even if I feel that twinge in my finger, it might not be from too much typing. It could be my body, like fighting itself.
Exactly, and it might not even stop at the joints. RA can affect the heart, lungs, even your eyes.
Eyes too. Wow, this is getting serious. I thought we were just talking about stiff fingers.
And that's precisely why catching it early is so important. Knowing the signs and getting treatment early can really make a difference.
Okay, so how do I know if it's just a random ache or something more?
Well, early RA often starts subtly. Maybe you notice some pain, a little swelling, typically in those smaller joints like your fingers or toes, especially in the mornings.
So that stiffness I feel when I wake up, could that be an early sign?
Mm.
I just figured it was, getting older.
Age plays a role for sure. But if that stiffness hangs around like for more than 30 minutes, it's worth checking out. And as RA progresses, those symptoms, they get more constant, the inflammation keeps building.
Okay, so what causes all this to happen? Is it just bad luck?
Unfortunately, it's not that simple. It's more like a perfect storm of factors. Genes, things in your environment, even hormones all seem to be involved.
Okay, let's unpack that. What do you mean by genes? Like, does RA run in families?
It can. There are certain genes like HLA-DR4 that increase your chances of getting RA, but it's not a guarantee, more like a predisposition.
So just because my mom has RA doesn't mean I'm, like, doomed to get it too.
Exactly. Genes might load the gun, but something has to pull the trigger, right? That's where the environment comes in. Things like smoking, even exposure to certain toxins can kind of activate RA in people who already have those genes.
So even if I have the RA genes,
Yeah.
my lifestyle choices still matter.
Absolutely. What you do, how you live, all that plays a role in whether RA develops and how severe it gets. And then there's the hormone angle. It's fascinating. Studies show that RA often gets better during pregnancy, then flares up afterwards.
Wait, really? Why would pregnancy have that effect?
It likely has to do with the huge hormonal shifts during pregnancy, particularly estrogen. Estrogen is a powerful immune regulator, so when those levels change dramatically, it can really impact RA activity.
I never realized hormones could have such a big impact on the immune system.
They really do. And speaking of hormones, here's another interesting fact. Women are 3 times more likely to develop RA than men.
3 times? Wow, that's a huge difference. Why is that?
It's complex, but again, hormones seem to be key. Estrogen, as we discussed, plays a role. Plus, there's some evidence that women's immune systems tend to be more, let's say, active than men's.
So a strong immune system is great for fighting off colds, but maybe not so great when it comes to autoimmune conditions like RA.
That's a good way to put it. And it gets even more interesting. Women often find their RA symptoms worsen during big hormonal shifts, like after pregnancy or during menopause.
It's amazing how interconnected everything is in our bodies. So with all these factors, genes, environment, hormones, how do doctors even begin to treat RA?
It really does take a multidisciplinary approach. It's not just about pills. It's about medication, lifestyle changes, the whole picture.
Okay, I like that, a holistic approach. But let's start with meds. What kind of drugs are used for RA?
There are a few types, each with a different way of working. We've got DMARDs. That stands for disease-modifying anti-rheumatic drugs.
Disease-modifying, that sounds pretty serious. What do they actually do?
DMARDs work to slow down RA's progression, protecting your joints from further damage. Methotrexate, that's a commonly prescribed DMARD, often the first one doctors try.
And what about those newer drugs I've heard about, biologics?
Biologics, those are another powerful tool. They target specific parts of the immune system involved in inflammation.
So like a smart bomb that goes after the troublemakers.
Exactly. One example is adalimumab. You might have come across it in your research. But while biologics can be very effective, they do come with potential side effects, so working closely with your doctor is super important.
It makes sense. Any other meds used for RA?
Yeah, NSAIDs like ibuprofen and corticosteroids like prednisone, those are often used for faster relief from pain and inflammation, especially during flare-ups.
It's more for managing those really bad days.
Precisely. But remember, medication is only part of the story. Lifestyle interventions are just as important for truly managing RA.
Okay, I'm all for that. What kind of lifestyle changes make a difference?
Regular low-impact exercise is a great start. Think swimming, yoga, tai chi. These help with flexibility, range of motion, even pain reduction.
So it's not about pushing yourself to the limit, more like gentle movement to keep things moving.
Exactly. And of course, diet plays a huge role. An anti-inflammatory diet packed with fruits, veggies, omega-3s, antioxidants, all that good stuff.
So loading up on those leafy greens, berries, fatty fish, good strategy.
Absolutely. Vibrant colors, whole foods, and don't forget stress management.
Stress management. I know chronic stress is bad, but how does it relate to RA specifically?
Well, chronic stress can actually make inflammation worse all over your body, including in your joints. So things like mindfulness, meditation, deep breathing, they can all be super helpful.
Okay, so exercise, diet, stress management, anything else?
Sleep. Good sleep is crucial for your body to repair and recharge, especially when you're fighting chronic inflammation like with RA.
It's amazing how all these pieces fit together. It really is a whole body approach.
Yeah.
Now, there's one more thing from your research I'm curious about fasting.
Fasting has been getting a lot of attention lately as a possible way to help manage RA.
I've heard of it for weight loss, but never for RA. How does that even work?
It's still being researched, but studies suggest that fasting can actually reduce inflammation and even change how the immune system behaves, potentially leading to fewer RA symptoms.
Wait, so not eating can help your body heal? That seems counterintuitive.
It might seem that way, but there's growing evidence to support it. One idea is that fasting reduces the production of certain inflammatory cytokines, which are like the messengers that cause inflammation.
So by reducing those messages, fasting could calm down the immune system's attack on the joints.
Exactly. And fasting also triggers something called autophagy, which is basically your body's way of cleaning house, breaking down and recycling damaged cell parts, further reducing inflammation and helping cells repair themselves.
That's like hitting the reset button for your cells. But what kind of fasting are we talking about here? Like not eating for days?
Not necessarily. There are different types of fasting, and what's right for RA will depend on the person. One option is intermittent fasting, where you cycle between eating and fasting periods.
That sounds a bit more doable. What does that look like in practice?
It's pretty flexible. You could fast for a certain number of hours each day, like 16 hours, or eat only within a specific time window, like 8 hours. It's more flexible than prolonged fasting, which is not eating for several days.
Prolonged fasting sounds intense. Is that even safe?
Prolonged fasting should only be done with a doctor's supervision. It can be effective, but it does have risks if not done right.
Right, I can see how it could lead to nutritional problems if not done carefully.
Exactly. There's also something called a fasting mimicking diet, which is very low in calories. It mimics the effects of fasting without completely cutting out food.
So you trick your body into thinking it's fasting, but you still get to eat something.
Basically, yes. It can be a good alternative for people who want the benefits of fasting but find it hard to go without food completely.
Okay, so we've got intermittent fasting, prolonged fasting, and fasting mimicking diets. It's amazing that changing when and how you eat could have such a big impact on RA. But it sounds like talking to a doctor is crucial before trying any of these, right?
Absolutely. Fasting isn't a one-size-fits-all solution, and it's not without risks. It's essential to work with a healthcare professional who can assess your individual needs and guide you safely. Remember, your health is a team effort between you and your doctor. You know, one of the things that makes RA so tricky is that it can look so different from person to person.
Yeah, it's not a one-size-fits-all disease, is it? That probably explains why finding the right treatment can be so challenging.
Exactly. What works for one person might not do a thing for someone else. And even for the same individual, treatment strategies often need to change as the disease progresses. RA is constantly evolving, so management has to evolve too.
This makes me think about something we talked about earlier, how RA is so much more than just joint pain. You mentioned it could affect different organs throughout the body.
That's crucial to remember. We can't forget that RA is a systemic disease. It can impact many organ systems, not just the joints.
I think a lot of people, myself included, tend to just associate RA with joint problems.
Yeah, it makes sense. Joint involvement is usually the most obvious symptom, but those extra-articular manifestations, as they're called, are just as important to understand.
Okay, so beyond the joint pain and stiffness, where else can RA cause problems? Give me the rundown.
Well, let's start with the cardiovascular system. People with RA actually have a higher risk of developing heart disease, stroke, and other cardiovascular problems.
Seriously? That's a bit scary. Why would a joint disease increase the risk of heart problems?
It all comes back to chronic inflammation. When inflammation is happening constantly throughout the body, it can damage blood vessels and make plaque buildup. That can then lead to heart attacks or strokes.
So it's not just about the pain and stiffness in the joints. It's about the underlying inflammation affecting the whole body. This is making me see RA in a whole new light.
That's a great takeaway. Okay, let's move on to another important organ, the lungs. RA can affect them too.
Lung issues, too. Wow, this is eye-opening.
RA can cause inflammation in the lining of the lungs, which can lead to something called pleurisy. That can cause chest pain and make it hard to breathe.
So someone might think they just have a bad cold, but it could actually be related to their RA.
It's definitely possible, especially if they've already been diagnosed with RA. Whenever there's a new or unusual symptom, RA should be considered as a potential cause.
Okay, I'll keep that in mind.
Yeah.
What are the eyes? I remember reading something about RA in the eyes.
Yes, RA can affect the eyes in a few ways. Dry eye is pretty common, but it can also lead to more serious conditions like scleritis or uveitis. Those involve inflammation of different parts of the eye.
And those can affect vision, right?
Unfortunately, yes. If scleritis or uveitis aren't treated, they can lead to vision loss. That's why managing RA comprehensively is so important.
Wow, I'm really seeing how widespread the effects of RA can be. It's definitely not just a localized problem in the joints.
Exactly. And we haven't even talked about the skin yet. Remember those rheumatoid nodules we discussed? Those firm lumps under the skin? Those are a common skin manifestation. But RA can also cause rashes, ulcers, even vasculitis, which is inflammation of the blood vessels.
So it's not just how RA makes you feel on the inside. It can show up on the outside, too, even affecting how you look.
Right. And those external signs often reflect what's happening internally, emphasizing the systemic nature of the disease.
Okay, all this talk about organ involvement is a bit heavy. It really highlights the need for that multidisciplinary approach we talked about earlier. Right?
Absolutely. It really takes a team of healthcare professionals working together to address every aspect of the disease, not just the joint symptoms.
So we're talking rheumatologists, cardiologists, pulmonologists, ophthalmologists, dermatologists. It's like a whole village to manage this one condition.
It really does. And it's not just about medical specialists. Don't forget about physical therapy, occupational therapy, counseling, and support groups. They can all play vital roles in helping people with RA live better lives.
It's about looking at the whole person, their physical, emotional, and social needs, not just treating the symptoms in isolation. Now, I want to switch gears a little and talk about something that's been coming up more and more in the research, the connection between RA and the gut microbiome.
That's a really exciting area that's generating a lot of interest in the scientific community.
Earlier, you mentioned that imbalances in the gut microbiome can contribute to inflammation. Can you explain that a bit more?
Of course. Imagine your gut microbiome as a complex ecosystem. Trillions of bacteria, fungi, and other microorganisms are living in your digestive tract.
It's mind-blowing to think about all those organisms living inside us, like a whole world down there.
I know, it's incredible. And in a healthy gut, all those microorganisms live in a delicate balance. They help with digestion, immune function, even mental health. But when that balance gets disrupted, it leads to dysbiosis.
Dysbiosis, so like when the bad bacteria outnumber the good guys in the gut?
That's a great way to think about it. And this dysbiosis can trigger inflammation throughout the body, including in the joints.
So how does this relate to RA specifically?
Research is showing that people with RA often have different gut microbiomes compared to people without RA.
So their gut ecosystem looks different. What kind of differences are we talking about?
Well, people with RA may have fewer of certain beneficial bacteria and more of potentially harmful bacteria. And these imbalances might actually be contributing to the chronic inflammation that drives RA.
So the idea is that if we can restore balance to the gut microbiome, we could potentially improve RA symptoms.
That's the hope. It's still an active area of research, but the evidence is growing that targeting the gut microbiome could be a new way to manage RA.
That's really exciting. So what can people do to promote a healthy gut microbiome?
Diet is key. Eating a variety of fiber-rich foods, fruits, vegetables, whole grains, helps feed the good bacteria in your gut.
So it's not just about avoiding certain foods, but actively adding foods that support gut health.
Exactly. Fermented foods like yogurt, sauerkraut, kimchi, those are great too because they contain live beneficial bacteria.
I love kimchi. Maybe that's why I feel good after eating it. What about prebiotics? I've heard those are important for gut health.
Prebiotics are like food for the good bacteria in your gut. They help them thrive.
So prebiotics are like fertilizer for your gut garden.
That's a perfect analogy. Foods like onions, garlic, bananas, and asparagus are good sources of prebiotics.
And I'm guessing things like processed foods, sugary drinks, and artificial sweeteners are the enemies of a healthy gut.
You got it. Those tend to throw off the balance of the gut microbiome.
Okay, so focusing on whole foods, fiber, and fermented foods is key. And we talked about probiotics earlier. How do those fit in?
Probiotics are live beneficial bacteria that you can get through supplements or fermented foods. They can help add more good bacteria and diversity to the gut microbiome.
So they're like reinforcements for the good guys in your gut.
Exactly. Probiotics can be good for your overall health and may help with managing RA symptoms. More research is needed, though, to figure out which specific strains and doses are most effective for RA.
This is all so fascinating. It's amazing to think about how connected our gut and our immune system are.
It really is. It shows just how important it is to look at health holistically. Everything is connected, and what we do to one part of our body can affect the whole system.
Okay, let's dive a bit deeper into this gut-RA connection. Is there anything specific going on in the gut that might be causing the inflammation in the joints?
That's where things get even more interesting. Researchers are starting to identify specific bacteria and their byproducts that seem to be involved in RA development and progression.
Like little microscopic culprits hiding out in our gut.
Exactly. One example is a bacteria called Prevotella copri. Studies have found that people with RA often have more Prevotella copri in their gut than people without RA.
And what does this Prevotella copri do? What makes it a suspect?
Well, it seems to produce certain inflammatory molecules that can travel through the bloodstream and contribute to joint inflammation.
So this tiny bacteria in the gut is sending out signals that cause problems all the way up in the joints. That's crazy.
It is remarkable. It's like a communication system gone wrong. And Prevotella copri isn't the only one. There's another bacteria called Collinsella. This one seems to be linked to the production of certain antibodies that are often found in people with RA.
So it's not just about direct inflammation, but also about triggering the immune system to produce harmful antibodies.
Exactly. And there's even research suggesting that gut bacteria might be involved in those rheumatoid nodules forming.
Wow, so these tiny organisms in our gut are going to be playing a much bigger role in RA than we ever thought.
It's a whole new way of looking at the disease. It's not just about genes or the environment. It's about this complex interaction between our genes, our environment, and our gut microbiome.
Okay, let's say someone has RA and wants to learn more about this gut-RA connection. What would you recommend they do?
The first step is always to talk to their doctor. A doctor can help assess the situation and decide if more investigation is needed. Trying to treat yourself based on what you find online can be dangerous.
Right, I totally agree. Dr. Google is not a replacement for a real doctor.
Exactly. But if the doctor thinks it's a good idea, there are a few things to consider. One option is a comprehensive stool test.
Wait, you can send a sample of your poop to a lab and have it tested for bacteria.
Yep, that's right. Those tests give you a detailed picture of your gut microbiome. They can identify imbalances or specific bacteria that might be causing problems.
That's pretty amazing. And then based on those results, you and your doctor could make a plan to try and rebalance the gut microbiome.
Exactly. That might involve changing your diet, taking prebiotic or probiotic supplements, or even, in some cases, fecal microbiota transplantation.
Fecal microbiota transplantation. That sounds familiar. Isn't that where they take stool from a healthy person and put it into the gut of someone with dysbiosis?
Yes, that's it. It's been proven to be effective for some gut conditions, and there's some early research suggesting it might help with RA too.
It's incredible what medical science can do these days. This whole area of gut microbiome research is truly fascinating. But now I want to talk about another important aspect of RA that I think often gets overlooked, the emotional and psychological impact of living with this condition.
You're right. That's a crucial part of the RA experience that definitely needs more attention.
I can't imagine how hard it must be to deal with a chronic condition like RA, both physically and emotionally.
It's a very difficult journey for many people. RA can affect every aspect of life: physical health, emotional well-being, relationships, work, hobbies. It's a lot to handle.
So beyond the physical pain and limitations, what are some emotional and psychological challenges someone with RA might face?
Well, the constant pain and fatigue can really wear you down. It's tough to stay positive and motivated when you're always dealing with discomfort.
I imagine it can feel like you're carrying this invisible burden that no one else can see or understand.
Exactly. And then there's the fear of the unknown. RA is a progressive disease, so there's always this uncertainty about the future. Will the treatments keep working? Will the pain get worse? Will I lose my ability to move?
Those are some pretty heavy questions to think about every day.
They are. And for some people, there's a sense of grief and loss for the life they thought they would have. They might have to give up activities they love or make changes to their lifestyle that are really hard to accept.
It's like grieving for the future they had planned.
That's a great way to put it. And then there's the stigma that often comes with chronic illness. People might not understand what someone with RA is going through, or they might make judgments based on how the person looks.
Like assuming someone is just being lazy or making excuses when they're actually in a lot of pain.
Exactly. It can be isolating and frustrating.
With all these challenges, what kind of support is out there for people with RA? What can help them cope?
First and foremost, a supportive healthcare team is essential. Doctors, nurses, other healthcare professionals can provide medical care, answer questions, and offer guidance.
Having healthcare providers who listen and understand must make a huge difference.
It really does. And there are resources beyond the doctor's office. Support groups can be incredibly helpful for people with RA.
I can see how connecting with others who are going through the same thing could be so validating.
Exactly. It can help people feel less alone and give them a safe space to share their experiences and learn from each other.
What about therapy or counseling? Could that help someone with RA?
Absolutely. Therapists can teach people coping skills for managing chronic pain, stress, and anxiety. They can also provide support and help people work through the emotional and psychological challenges of having a chronic illness.
So it's about addressing the mental and emotional side of RA, not just the physical symptoms.
Exactly. And don't forget about all the resources available online. Websites, forums, social media groups. There's so many places where people with RA can connect and find information.
The internet can be a great tool for finding support and information, but it's important to be careful about which sources you trust.
That's true. Stick with reputable organizations and websites that provide evidence-based information.
Okay, so we've got support groups, therapy, online resources. What about lifestyle changes? Can they help with the emotional side of RA?
Definitely. Things like exercise, relaxation techniques, and spending time in nature have been shown to improve mood and reduce stress. Those can be really helpful for managing the emotional challenges of RA.
And those are all things that can benefit overall health and RA management too, right?
Right. It's all connected. Taking care of your physical health can positively affect your mental health and vice versa.
This conversation has been so insightful. I feel like I'm finally understanding how complex RA really is. Thank you for explaining all this.
It's my pleasure. I'm always happy to help people understand this often misunderstood condition.
Now, before we go to the last part of our RA deep dive, I want to go back to something we touched on earlier. The importance of catching RA early.
Absolutely. The earlier you diagnose and start treating RA, the better the chances of a good outcome.
So for our listener, what are some red flags they shouldn't ignore?
The most common symptom is persistent joint pain and stiffness, especially in the morning or after you've been resting for a while.
So if you're waking up with stiff, achy joints that take a while to loosen up, that's a sign to pay attention to.
Yes, definitely. If that stiffness lasts more than 30 minutes, it's worth getting checked out. Other early signs include swelling in the joints, warmth or tenderness to the touch, and just feeling tired or generally unwell.
So it's not just about the pain itself, but noticing these other symptoms that go along with it.
Exactly. And keep in mind that RA can affect any joint in the body, not just the ones in your hands or knees.
So any persistent joint pain, no matter where it is, should be taken seriously.
Absolutely. If you're experiencing any of these symptoms, don't ignore them. Talk to your doctor and advocate for your health.
Getting diagnosed early can make a huge difference in how well you're able to manage RA. This has been so informative. I bet our listener is feeling much more knowledgeable about RA now.
I hope so. It's been great sharing these insights. I hope our conversation will empower our listener to take an active role in managing their health and advocating for themselves.
Before we wrap up part 2 of our RA deep dive, I want to acknowledge that this is a lot to take in. It's okay to feel overwhelmed. Just focus on what feels important to you and reach out to your healthcare team if you have any questions or concerns.
I agree. Open communication with your healthcare provider is key. Be an active participant in your healthcare journey.
Okay, are you ready to move on to the final part of our exploration of RA?
Ready when you are. Let's dive into some practical tips for managing RA and explore what the future might hold for treatment options.
All right, we've covered so much from how RA affects the whole body to that fascinating link with the gut microbiome. But let's get practical now. If I'm listening to this, I'm probably wondering, okay, but what can I actually do to feel better right now?
I get that question all the time. And while those long-term strategies are important, there are definitely things you can do to get some quick relief from RA symptoms.
Okay, let's talk quick relief then. What are your top tips for dealing with RA pain and stiffness right when you need it?
One of the simplest but most effective strategies is heat and cold therapy. Applying heat to those stiff, achy joints can help relax muscles and increase blood flow.
So like a warm bath or a heating pad.
Exactly. Heat can really soothe those stiff joints. And on the other hand, cold therapy can help reduce inflammation and numb the pain.
So an ice pack on a swollen, painful joint.
Yep, that's it. Try both heat and cold and see what works best for you.
I like that. It's like you get to choose the temperature you need for your joints. What about over-the-counter pain meds? Do those have a place in managing RA?
They can be helpful. NSAIDs like ibuprofen or naproxen can give you some relief from pain and inflammation. But use them carefully and check with your doctor about the right dose and how long to take them.
Right, because even over-the-counter meds can have side effects, right?
Exactly. And another thing you can try for more localized relief are topical creams and ointments.
You mean those creams you rub directly on the sore joint? Do those really work?
They can be surprisingly effective. Some have ingredients like capsaicin, menthol, or salicylates. They create a warming or cooling sensation that can help distract from the pain.
It's like you're tricking your brain into feeling something other than pain.
You got it. And sometimes the simplest things can be the most effective. Rest and elevation can make a big difference.
So giving those joints a break and propping them up to help reduce swelling.
Exactly. And don't be afraid of gentle movement. Stretching or some low-impact exercise can actually help improve flexibility and lessen stiffness over time.
Hold on, you just said rest was important and now you're saying to move. I'm a little confused.
It's about finding the right balance. Gentle movement can be good, but don't overdo it and listen to your body. If it hurts, stop.
So finding that sweet spot where you're not pushing too hard but also not just sitting around all day.
Exactly. And if the pain is really bad and those simple things aren't helping enough, definitely talk to your doctor. They might prescribe stronger pain meds or think about other options like corticosteroid injections.
So there are more, let's say, intense treatments available if needed.
Absolutely. No need to suffer in silence. There are ways to manage even the most severe RA pain.
That's good to know. Okay, let's switch gears a bit and talk about the future of RA treatment. What's coming down the pipeline in terms of research and new ideas? Anything that gives you hope?
Oh, it's a very exciting time to be working on RA. There's so much promising research going on. I'm very optimistic about the future of RA treatment.
Okay, I'm ready for some good news. Fill me in. What are scientists working on that has you so hopeful?
One area that's really generating a lot of excitement is precision medicine.
I've heard that term before, but I'm not really sure what it means for RA.
It's all about tailoring treatment to each individual patient based on their unique genes, their lifestyle, and how their disease behaves.
So moving away from a one-size-fits-all approach and towards a more personalized approach.
Exactly. The goal is to find more targeted therapies that are more effective and have fewer side effects. It's about getting the right treatment to the right person at the right time.
That sounds amazing. How would that even work?
Well, one way is through genetic testing. By looking at a person's genes, doctors can figure out the specific mechanisms that are driving their RA and choose medications that directly target those mechanisms.
It's like customized medicine based on your DNA.
I like that. And researchers are also working on new biomarkers that can help predict how someone will respond to a specific treatment.
So you could know ahead of time if a medication is likely to work for you. That would be incredible.
It would take a lot of the guesswork out of finding the right treatment. It would be a game changer for so many people with RA.
It sounds like we're entering a whole new world of more precise and effective treatments. What other innovations are out there?
Another exciting development is the emergence of biosimilars.
Biosimilars, that's a new one for me. What are those?
They're basically highly similar versions of existing biologic medications, just as effective, but usually much less expensive.
So, like generic versions of biologics, that would be huge for making these treatments more affordable.
Exactly. Biosimilars have the potential to make these effective but often very pricey treatments available to more people.
That's fantastic. Easier access to more affordable medications is always a win. Any other areas of research that have you feeling optimistic?
Definitely. There's a lot of amazing work being done with stem cells and how they might be used to treat RA.
Stem cells are those cells that can turn into any other type of cell in the body, right?
That's right. Scientists are looking at ways to use stem cells to repair damage in the joints or even reprogram the immune system to prevent further damage.
That sounds like something out of a sci-fi movie. Is that really possible?
It's still early days for stem cell therapy for RA, but there's a lot of potential. We're just starting to scratch the surface, and I'm excited to see what the future holds.
It's amazing to think about the possibilities of regenerative medicine and how it could revolutionize the way we treat RA. So, with all these advancements, are we getting close to a cure? Is that a realistic goal?
Of course, a cure is the ultimate goal. While we're not there yet, I truly believe that with all this groundbreaking research and these incredible innovations, finding a cure for RA is within reach. It might not happen tomorrow, but I'm confident it will happen.
That's really inspiring. And in the meantime, it's important to remember that RA is a manageable condition. With the right treatment, support, and self-care, people with RA can absolutely live full and active lives.
I completely agree. Knowledge is power, and understanding this complex disease is the first step to effectively managing it. It's about empowering patients to be active participants in their own healthcare.
This deep dive into the world of RA has been so eye-opening. We've covered everything from the basis to the latest research, and I feel like I have a much deeper understanding of this complex condition.
It's been my pleasure to share this journey with you and our listener. I hope this information will help our listener take control of their health and advocate for what they need.
And before we wrap up, I want to leave our listener with one final thought. Knowing that RA is so much more than just joint pain, how does that change your perspective on health and well-being? What can you do today to learn more or stand up for yourself if you think you might have RA?
Those are great questions, and they really highlight the importance of being aware of your body and taking a proactive approach to your health. Pay attention to the signals your body sends you, and don't be afraid to talk to your doctor if you notice any persistent symptoms.
Exactly. Don't dismiss those aches and pains. Talk to your doctor, do your research, and remember, you are your own best advocate when it comes to your health.
I couldn't agree more.
Thank you for joining us on this deep dive into the world of rheumatoid arthritis. Until next time, stay curious and take care.